Hello, everyone. Welcome to another installment in our Pediatric Hospital Medicine podcast series. I think we're at episode number 9. Again, coming to you from Children's Hospital of Pittsburgh of UPMC. My name is Dr. Tony Tarchichi. I'm a med-peds trained pediatric hospitalist here at Children's Hospital of Pittsburgh at the Paul C. Gaffney Diagnostic Referral Group. Let's do our quick disclaimer. This podcast is for general informational educational purposes only and not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. So I want to first introduce my guests and thank them for being on. Today's a special podcast. Today we are discussing Puerto Rico post-Hurricane Maria. We were fortunate enough to get one of the pediatric emergency room physicians at the University Pediatric Hospital in Puerto Rico. That's Dr. Jahzel González-Pagán, who will talk to us via the phone. And I will tell you what happened was you're going to hear two different types of audio on this podcast, loud and clear and not loud and clear. We tried to get Dr. Pagán on Skype, and their internet service in Puerto Rico at this point still is very poor. We could not get Skype. We tried to get her on a landline, and the landline service was not working either. So the only way we could get Dr. Pagán on the podcast is through WhatsApp on the cell phone. And that was the only way we could communicate with them in any effective way. So I also am lucky enough to be joined by Dr. Lilinete Polsunas, who's a Combined Pediatric and Anesthesiology resident, first-year intern at the Children's Hospital of Pittsburgh at UPMC, and Dr. Graciela Bauzá, Assistant Professor of Surgery and Critical Care Medicine at the University of Pittsburgh. First, you're going to hear our conversation with Dr. Jahzel González-Pagán, and please keep in mind while you're listening that this is one of the major metropolitan city areas in Puerto Rico to help put the kind of logistical trouble we had in perspective.
Okay, let me see if I can hear you. I'm so sorry.
All right.
Okay,
So let's dive right in. So Hurricane Maria landed on September 20th of this year. You guys, can you hear us?
Yes, I can hear you.
Okay. Everyone was watching the weather reports and looking for it. How quickly did you realize how bad this was really going to be for your island?
Well, at first, we were basically watching the hurricane. We had tropical storms and hurricane before, so we were hoping that it would go away. Or at least go, around the island like Irma. But I would say like on September 18th, like 2 days before, that it turned actually to category 4 and then to 5. We did realize that it was going to hit us, that there was no way out. At that point, we already had a contingency plan in terms of residents and attendings and the personnel. But I think like 2 days before we said, okay, this is going to happen. Mm-hmm.
So just for all the listeners to know, we originally arranged to talk to, we're talking to Dr. González in Puerto Rico, who's a pediatric emergency room physician there at University of Puerto Rico Children's Hospital. We initially tried to do a Skype meeting, and that didn't work because of the internet access. We tried to do a landline telephone so we could record. That didn't work. The only way we're able to talk to Dr. González at this point is through WhatsApp on our cell phones. So, Dr. González, is this how the communications have been in Puerto Rico since this has happened? It has not improved?
So it depends. I think in the metro area it's been a little bit easier, but everywhere else it's really hard. Even, you see right now for the internet, even for Skype or WhatsApp, it's hard, that in terms of communications. It's been a hustle everywhere. There's people that haven't been able to connect around the island. There's families that haven't been able to talk. So a lot of people are using actually other phones from even strangers to connect with their families, even the news to connect with the families. So yes, in terms of communications, they're really, really hard.
And up until yesterday, you didn't have landline service at the hospital, is that right?
At my office, no, I didn't have any, but it depends. Like sometimes comes and goes. Also, the cell phones, the different carriers, like, different companies, I'm going to say the names. It depends on what company you have. It's going to be how good is the signal. Because there were many towers that went down with the hurricane winds. So, in terms of landline, even cell phones, satellite, it's been really, really hard.
Let's talk about supplies. Let's get right into it. So we keep hearing that the military is in Puerto Rico clearing roads. Have you noticed an increase in supplies? And why don't we start talking about food and water to the people of Puerto Rico?
I would say say more than supplies, it would be distribution. I think that's the main problem. We actually are getting supplies even from non-profit organizations, but it's basically how quickly they get to the people and what people, because it depends on the roads, right? The roads, the mudslides, the flooding. We're still getting floods everywhere. Like yesterday, there were rain showers, thunderstorms. So every now and then, like every 2-3 days, we get another flooding. So it's hard to get to the people. At first, also, we had a problem in terms of supplies getting to the airport and not being able to move the supplies because we had no diesel or no gas to do that, or we had no trucks. So even though we were getting them, again, we were not able to distribute them around the island. Right now, the military personnel are getting supplies to the center of the island with helicopters or charters directly to the west area, but there's people that still have not supplies, not even drinkable water.
Is gasoline any easier to get at this point or no?
It's a little bit easier, but we still have problem. I think that during the first week or 2 weeks, it was horrible to get, even for the medical personnel to get to the hospital. We had to do lines of 5 to 6 hours, even though we had shift. The governor actually made an instruction to do another line for the police and for the firefighters, for the medical personnel, for the nurses. But even though we had to make lines like 5-6 hours and fight with everyone basically because there was no gas coming to the gas stations. Right now it's a little bit easier.
And there are more gas stations.
Exactly, there are more gas stations open. I think up to yesterday, there was 78% of the gas stations were open. But we still have almost 21% closed. So we still have lines, but not as bad as the first or second week.
Speaking of supplies, the children's hospital itself that you're at, how are you all doing on supplies? Are there things you still need? Are you getting things?
So in terms of supply, we are getting a lot of supplies, but yes, we need more supplies because of two things. First, before Maria, we were hit by Irma, and even before that, we were short of supplies because we have a restricted budget due to our economy, right? So that's the first. Second one is that we are receiving a lot of people from other hospitals that are closed. And actually, we have a third one. We are distributing to other hospitals. Like, we have a distribution center, so every supply that we get from non-profit organizations, we are moving them around the island. Right now, there's a team that went to Aguadilla, which is on the west, with a lot of supplies, including air chambers, IV fluids, like even blue bags, like everything they need. We're sending them to other hospitals, to other small towns, to community centers. So yes, we're going to need supplies for a long time because we're basically helping the government to distribute these supplies to other areas.
So how did a lot of other hospitals close? Did you receive a lot of patients after Maria?
So in terms of numbers, I don't have the exact number, but yes, we have a lot of hospitals that close. And in Puerto Rico, we have small urgent care centers called CDTs. Basically, those centers are part of the government, and it's like a filter. People get to those urgent cares, and if they need to go to tertiary hospital or secondary hospital, they can go there. A lot of those urgent cares closed. So basically, we are getting a lot of that people that usually stay over there in our tertiary hospital. And there are a lot of secondary hospitals or tertiary hospitals that closed. For example, last week, Friday, a hospital called Riders Hospital had to close because the generator basically collapsed. So all those people were moved to the U.S. comfort ship right away. And it was, I think, that more than 100 patients, even patients in mechanical ventilators. So there's a lot of hospitals that are closing or are not working at the full capacity because they depend on diesel generators. There are a lot of areas that are closed. So yes, there's a lot of damage in the hospital.
Are you still getting patients? Are they coming in? Are a lot of them coming in? And what are they coming in with?
Okay, so during the first days, we had a lot of mechanical ventilator-dependent patients, chronically ill patients that use our hospital as a shelter. We also had dialysis patients that were staying at our hospital to basically to guarantee that they would have their dialysis. After that, we started receiving the acutely ill patients. Hold on a second. Yeah, we're having a little bit of noise.
For those of you listening at home, Dr. Gonzalez is outside to get the best signal so we can communicate with her through WhatsApp. So we're going to get a little bit of cars or something, but we'll go right through it, and we'll edit out whatever we need to edit out.
Okay, I'm back. So can you hear us now?
Yeah.
Okay, perfect. So basically, chronically ill patients, oxygen-dependent patients, dialysis patients. After that, we started getting trauma, lacerations, fractures, even carbon monoxide poisoning because of the generator. So it was really intense having those types of patients at the same time at the ER. It was an intense week.
So at the same time in the hospital, you had all your chronic mechanical dependent patients, ventilator dependent. You had your dialysis patients who were staying there as a shelter, and then you started getting carbon monoxide poisoning, traumas, lacerations. Have you started seeing any? Go ahead.
This chronically ill patients to other areas, but that's another topic that is really important to discuss. We can discuss it later. How we're doing that. Right now, in terms of acute patients, we're getting there more gradually because, again, other hospitals are opening slowly, so we're getting the normal flow of the ER, but the first 2 weeks were really, really intense.
Let's talk about the topic you had just brought up.
Okay, perfect. So yes, so we are trying to facilitate basically the needs of these patients, these special kids. There's a lot of patients that depend on oxygen or any other chronic treatment. It's been really hard because I would think that nobody expect to be out of the power for 6 months. So there was no contingency plan for that. We usually get those patients and we can work with them in a couple of days and then move them if there's any emergency. Like, for example, Irma, it was really quick, but not in Maria. So we're working with the government trying to make a facility so they can stay there and there could be proper care for them. They need generators, they need diesel. There are patients that have been able to go to the mainland United States, but there are a lot of patients that don't want to go outside Puerto Rico. They want to stay with their home. They want to stay with their families, so it's hard for them. So, like yesterday, one of the doctors, actually she's Dr. Pumarejo, director of the emergency department right now. She was able to get in contact with multiple services, including pulmonology services in our hospital, to make a weekly clinic to evaluate these patients, also to call these patients or going to their homes to see how are they doing, because there's a lot of, again, there's no communication. So we haven't been able to contact them by phone, even though we have a list. Again, we don't have the whole list. We have the list of our hospital. But there's a lot of people, a lot of patients that went to other hospitals. So we're trying to, to do a list, to know the census, to get to their homes, to give them diesel, to work to create a good facility. But it's been really, really hard.
And now we're talking about your cerebral palsy patients, your neurodevastated patients, kids with G-tubes and trachs and pegs. And those are the patients we're talking about. But let me ask you, are emergency medical services up and running? If a person has an issue, is emergency medical services running to come pick them up?
Yeah, so basically, they're the ones who pick them up and bring them to the facility. I think is the appropriate one. It's usually for kids. It's usually us because we're the tertiary hospital here, and we're the ones who basically take care of them. But they could go to either hospital depending on how critical they are. So yes, the EMS are the one who basically transport them, unless they have a company or a facility which can do that. But right now it's really impossible.
Before the hurricane, did you all evacuate your NICU babies, or did they stay there, or are they in Miami? Where are they now?
Okay, so before the hurricane, the day before, the NICU babies were moved to the third floor. They're usually on the floor, which is the top of the building. They were moved to the third floor, which is the general pediatrics area. So we discharge as many patients from the general peds area, so we will be able to move those patients to the third floor. Those critically ill babies from heart surgery or other surgeries that were needed immediately were transferred after Maria to a Miami hospital. But right now, yesterday, they were still on the third floor, and I think yesterday afternoon and today they are currently moving those babies to the sixth floor again. So we still have babies. We actually have like a census of 45 babies in the intensive care unit.
How is the census in the hospital? Are you all
full,
or are you normal census for this time of year?
two things. At this time of year, we're always full. And because we had to decrease the census due to the NICU babies going to the Gen Peds area, we actually have limited space. So there's people waiting a little bit longer in the ER to get transferred to upstairs, but we are actually full.
So in terms of humanitarian aid, you said that a lot of the private agencies are getting supplies in. Is the Red Cross doing a good job? Have you seen who's able to get supplies in and distribute it to the people of Puerto Rico?
Yeah, so we've been blessed with many nonprofit organizations, including one is called Doctoras Boricuas, which is basically a Facebook page done by a lot of doctors from Puerto Rico that are right now in the United States. So Doctoras Boricuas, the Red Cross, United for Puerto Rico, AmeriCares. There's so many, and Project Hope is helping us a lot, even in the hospital. We actually, they've been sending supplies to us, and they've been helping us getting the supplies to other people. As I talked to you before, we send doctors and medical students and residents with the supplies to other areas with them. We've seen what they are doing right now. We also have a lot of hospitals from all around the USA helping us. That's really important to us, because that's the way we're getting help. We're getting aid around Puerto Rico.
And just for all the listeners listening, I'm going to put up a link to every organization that Dr. González mentioned on the podcast. So if you want to donate to those organizations directly that are able to get aid in and distribute it, you can just click on the link. So, and we have one of the doctors from Dr. Boricuas here, so which we'll talk to in a minute. And let me ask you about the residents and the medical students. Are you all still teaching, or is it still business as usual in terms of the teaching services?
Yes, so during the first week and a half, I would say they were like an on-call schedule. So it was easier for them to get here because of the cutoff on the roads and for the decrease in diesel. Right now, they're running as a normal schedule. I actually can put you on Dr. José Fuentes, which is the acting chief right now, so she could tell you a little bit more what's going on in terms of residency. Hold on.
Okay.
Hello?
Dr. Fuentes, thank you for joining us.
Thank you for having us. So basically, during the first 2 weeks, we were doing 48-hour shifts, which were alternated every 12 hours. So the residents have to stay in the hospital for 48 hours to make sure that they could be here the next day, and we would have people able to work at the hospital, but they would work only 12 hours and then sleep at the hospital to continue the next day to do another 12-hour shift.
How many residents do you have at the hospital?
I'm sorry?
How many residents do you have at the hospital?
We have approximately like 35 each year. It's around 12 to 13 residents. So it's a little bit like close to 40. And we had around 15 residents working each 48-hour shifts. We were doing that so that residents would have at least 48 hours to get gas, to get cash or food, and to see their families and all that, because one day was definitely not enough. Even 2 days was not enough for them to do all that, especially those whose families are not in the area where the hospital is, in the metropolitan area. But after 2 weeks, that everything started to normalize, as much as normal we can say here, we changed to normal, and now like all the residents are working at the hospital. The clinics are starting to open for the subspecialty, so we have placed all the residents in each place, and the medical students started this week working again at the hospital and doing their clerkships and everything. The other thing is that during this week we started to do the didactics, so the academic calendar. We started this week so that we wouldn't get so behind, and to meet with all the ACGME and all that stuff that we have to do as well, aside from, post-hurricane disaster stuff.
Did the medical students sleep at the hospital as well?
So no, they did not. Basically, the medical students stay at their homes. It's another different curriculum. It's different as the residents. They did actually come afterwards to volunteer because the school was closed. So a lot of the students were here during the day, basically helping us to get food to the families, to help with the supplies getting to the hospital. But now, as this week, they're already in their normal schedule, taking their classes and doing their clerkships. Actually, we had a curfew, so that's another thing. During the first 2 weeks, we had to stay home as soon as 7 p.m. It's been getting, changed depending on the week, but that's another story. So that's why the residents had to stay also at the hospital during the first 2 weeks due to the curfew.
Now, Dr. González, it's obvious that Puerto Rico needs more aid, more supplies, and better distribution. With all of that being said, how is, and this is a hard question for you to answer, how is the morale of the staff? How are you all holding up?
So that's a tough question, but I think it's a really good one. I would say that we do have a lot of hope. I think we're getting stronger with every day. We're getting a lot of experience on how to deal with this, but it's also frustrating at some point. We need more help. At first, we were getting any of what we needed, as soon as we needed it. So it was really hard and it was really sad for us, but we've been able to move around, to search for other things, to look for help. We're getting a lot of help from outside Puerto Rico, and I think it's been great to see the response of other people. But I would say it's like mixed feelings, that you're happy that you're getting help, that you're happy you're doing a lot of friends, that you're happy your community is getting, it's helping us. But it's hard to see your family, it's hard to see your community flooded with a lot of electric cables down, with no electricity, no power, no water, no drinkable water. We're getting a lot of infections here, so it's really hard. I think it's mixed feelings, I would say.
I'm going to ask you one more question, and then I'm going to give you a chance to say anything you want on the podcast. You said you're getting infections from drinkable water. Are you getting infectious diseases because of the undrinkable water? Are you starting to see what we would expect?
Yes, so at first we were getting a lot of conjunctivitis, which we were expecting scabies and lice, but now there's reportable cases of leptospirosis, which basically is, it happens in Puerto Rico, but not at this level. You could see some cases in kids and in adults, but not, right now there are 9 suspected cases and 2 suspected deaths of that disease. And it's because of the non-drinkable water. There are people who are basically drinking from the river, and there's a lot of animals. There's a lot of sewage, basically water going through there because there's of the floodings, the mudslides, or everything. So yes, we're getting cases. They're not official right now. It's suspected cases, but we had already, in terms of the whole Puerto Rico, not here in the hospital. There's been 2 cases reported in the East Coast right now. Mm-hmm.
I'm going to let you close us out, Dr. González. Is there anything else you'd like to say or discuss?
So first of all, thank you for having us. It's been a pleasure to be able to talk to you and to your team about what's going on in Puerto Rico after Maria. We are really thankful for all the community outside Puerto Rico, as I already mentioned. All the doctors from Puerto Rico helping us, or the doctors from the mainland, doctors I even know are talking to us, or calling us, or emailing us to help us. So we're really grateful and thankful, but we need more help. We need more help from the government. We need more help from everyone who can. And I know that Puerto Rico is going to raise and it's going to get back, maybe not as normal as we did before, but we're going to have a new normal, and we're going to have a new life and have a lot of hope that the sun is going to shine again upon us. So thank you to all my students, to all my residents, to all my staff that's been working really hard with our hospital. So I just have a lot of thanks, and I feel even though very blessed with my personnel.
And thank you very much for being on the podcast. We wish you the best.
Thank you so much for everything. Thank you so much.
Thank you. So thank you to Dr. Jahzel González-Pagán and Dr. Josie Daniele Fuentes Gutierrez, who is the third-year pediatric resident, chief resident that we spoke to, along with Dr. Pagán, who is the pediatric emergency medicine physician in Puerto Rico. And now we're going to go back to our guests in Pittsburgh, Dr. Graciela Bauzá and Dr. Lilinete Polsunas. And I believe both you doctors are a member of Doctoras Boricuas. Is that right?
Yeah.
Can you tell our listeners what that is?
We've been able to coordinate a lot of our efforts through Doctoras Boricuas, whose founder is Dr. Dalian Caraballo, located in Miami, who actually started the Facebook group the day before the hurricane. So that has been an immense resource for all of us around the United States and those who are not in Puerto Rico to communicate with the physicians in Puerto Rico. They even had to expand it to admit male physicians so that we could get in touch with them, because the need was so much to coordinate that we needed to include our other half to reach out every area. So a big shout out to her for this immense effort that has really helped the island.
And for our listeners who don't speak Spanish, what is Doctores Boricuas translated into?
Puerto Rican doctors, but in the female
version.
Okay, good. Well, first, let me apologize because I didn't thank you for being on the podcast, both of you. I do appreciate your time. So why don't we get right into it? So through Doctores Boricuas, you've been able to communicate back home and see what the needs are and see how you can help. Can you talk about the successes and some of the challenges you've had with getting aid to Puerto Rico?
So when this all first started, we sort of, our group of Puerto Rican friends, which includes Dr. Polsunas and a bunch of our other doctor and non-doctor friends here in Pittsburgh, got together and sort of decided to figure out how we could help, do donation drives, fundraisers, which we've had a number of both of those, and then the physician portion decided to try to figure out how we could get medical supplies. So we appealed to our hospitals and departments to see how we could get donations in a larger capacity, not just things that we could collect sort of on our own, and figure out how we could get them there, because that's another big problem, the logistics of getting things from far away into the island. And so our hospitals, so including UPMC and AHN, were able to give us the name of companies such as Global Links and Brothers Brother Foundation, which are here in Pittsburgh, who collect surplus medical supplies and, amongst other things, and help in disaster areas. And so we were able to, and both of those agencies, our nonprofit agencies, have been incredibly valuable and helpful and communicative with us on a daily basis on how they can help us. And we've sort of helped them through Doctoras Boricuas and our own personal contacts through WhatsApp and Messenger, as to where we want to send things, who can pick up at the airport. And so it's been a constant communication on a daily basis of what the needs are and what we can send them. So we've been doing that pretty much from almost day one. Once we sort of were able to get contact with our families and figure out how things were doing, it's what we've been focusing our efforts on. We also have friends, not to deter from the medical portion, who have done Amazon wish lists, focus on more of the emergency items that they need, in addition to solar-powered different lights, generators, water purifiers, things that are depend on just solar energy, because it was anticipated even before the hurricane hit that it'd be months of no power in many areas of the island. And even currently, only those that are around major hospitals are now getting power, which is still 10% or less. Yeah.
How are these agencies getting the supplies to Puerto Rico?
That has been one of the challenges. We have been luckily, like we have encountered a lot of contacts that have contact within the airlines, and like I think you can speak more to the whole airport.
So Brothers Brother Foundation, whom we heard of through our hospitals and as well through the Latin American Cultural Union here in Pittsburgh, works with the Pirates Foundation, and the Pirates did a donation drive and were able to get a plane with FedEx, donated by FedEx, a cargo plane, and our first shipment of medical supplies, which we piggybacked onto that plane, was able to go last week and get delivered. And so we got contacts at Centro Médico as well as the Hospital Pediátrico, which were able to personally receive the supplies there and take them back to their hospital. And so the Pirates, and thanks to the city of Pittsburgh, donated so much that they had to get a second plane, who I'm not quite certain just yet is being provided by who, but the Pirates requested it and should hopefully ship out of or fly out of Pittsburgh today, although we don't have the exact information. And we have another hospital that is pending the shipment of more medical supplies.
What we have is the Pittsburgh Pirates, hospitals and private citizens working together to get supplies over there. Can you talk about what happens when the supplies get there? There has to be someone there to pick them up. Is that right, or what happens?
Part of the Doctoras Boricuas, the group, there's a whole list of hospitals and point contacts and addresses that once you identify a hospital that you want to send the resources to, we have immediately contacted them and kind of let them know. Ask them, like, what do you need? Give us your list, and then facilitate that to the group here to try and collect the exact items that they need. And then once we know that the plane is going to head there or anything like that, like, let them know, like, you need to come pick this up. And I think that's pretty much how they've been doing, having those point contacts at the different hospitals come and pick up the supplies. And I think that's the main way.
Is there anything else you all want to mention and discuss?
Yeah, we want to thank Pittsburgh and all their help, as well as our hospitals and departments who have either independently collected things, created money donations, as well as these two nonprofit foundations, Global Link and Brothers Brother Foundation here in Pittsburgh and in Baltimore, who's been working with us as well in donating these supplies, which are of immense help. And hopefully we've been able to help with networking so that we can get things to the island in places that are in true need, including some of these CDTs that they mentioned, these urgent care centers throughout the island who are starting to open up and kind of take the flow out from the metropolitan area and attend those who are unable to reach that area, particularly with all the diseases that are sort of now popping up because of lack of drinkable water or clean water. In addition, I want everybody to keep in mind and remember that this is a hot topic right now. And there's a lot of disasters going on currently in the United States and the world, but particularly of recent. But our island is going to be in need for months to come. And so to not forget that our efforts are going to be ongoing.
I think, echoing what Dr. Bauzá just said, we are very grateful of all the help that we have received. I am especially thankful to my department, the Department of Pediatrics and the Children's Hospital of Pittsburgh. They have been incredibly supportive, like from all levels. And I've been in direct contact with the chair, and they have gave me all the contacts in supply chain to be able to send them the list from the hospitals I want to help, and they have been collecting those items for me. In addition to that, my own program director within the Department of Pediatrics and Anesthesia, they have given me pounds and pounds of supplies. At this point, I like 62 pounds that I've been delivering myself to Global Links. At this point, I'm getting a lot more supplies, and by October 18, that I'm hoping to bring back to Global Links too. All of that. In addition to that, the residents, my co-residents, they have been my rocks through all of this. There's no way I could have done this without them. They not only they have helped me like with fundraising, and we have collected more than $1,500, $1,500 that we were able to send to donate through Unidos por Puerto Rico and many of the other organizations. In addition to that, they've been constantly, my support, like whenever they see me, like, how's the family doing, how's everything, and that means a lot. Especially because we all have been working obviously really, really hard. This is home, this is friends, this is family, but at the same time we also have our concerns about our family. Are they doing okay? Do they have all they need and all those things? So it's been full-time job on the side. Yeah,
I agree. I think our departments have been really helpful. My partners have been able to relieve me from actually my service duties because this has taken over our lives. Even from getting our families to come over. So I'm currently have my family in the United States as well as everything happened. So we've been very thankful for the support of me in particular, my partners, for covering my patient care duties so that I can attend to these things. And also my department in specific, who's had their own drive or emergency supplies are about to ship to like a particular neighborhood that is in dire need of just water and wipes and diapers and off and just, different random medications. So again, like I mentioned, we're going to continue to have these needs throughout. So I hope everybody stays receptive and keeps us in mind.
I think that's important to echo. Other children's hospitals around the country are probably doing similar things. And if, the more we can do to help, the better. From our end, we can do another podcast in a few months and see how the recovery effort in Puerto Rico is going. We can all get together again, and hopefully we can get Dr. González on Skype, which would be a nice win to see how things are going. purpose for this podcast is really to raise awareness and to see what's going on in Puerto Rico. Obviously, from a medical slant, this is a medical podcast, but from a humanitarian slant, to see how the people are doing, because these are people that are American citizens just like us. About 3 million American citizens are living in Puerto Rico. So our heart goes out to them and their families. Anything we can do to help, we will do our best from our end on the podcast, whatever small thing it is. This brings us to the end of the podcast, and we always tend to wrap up by starting with acknowledgments. I would like to acknowledge and thank Drs. Sarah McIntyre and Dr. Basil Zatelli, who helped me prepare questions and ideas for this podcast. I also want to thank Dr. Tamara Feliciano, who helped put us in contact with Dr. González. And I also, as always, I want to thank our guests again, all of them. I do want to thank all of the agencies that have been proven to help, and especially our own Pittsburgh Pirates from Major League Baseball team, which was a very nice surprise to hear. I would like to thank, as always, Dr. Megan Keene Tarchichi, who helps me with everything. For our next podcast, as of yet, I'm not sure what the topic is going to be, but we will come up with a topic and put something together. As always, if you all have any questions or concerns or comments, please feel free to email me at Tony, Tony, .tarchichi, that's TARCHICHI, at chp.edu. I did not say that, but for this podcast, we are not doing CME credit. This is more of a special interest story, so no CME credit will be given. Other podcasts, almost all of them except the Hurricane Harvey one, does have CME credit associated. Please just click on the link. And if you want the references for any of the podcasts, they are where the CME credit questions are. Click on the link and you'll be able to see them as well. Thank you all very much for listening. I really appreciate it. You all have a great day, and that's it.